This is Charles Clinton, and this video I am making is because I've seen a very distinct approach in my own management of stress related disorders and psychological issues, specifically in this case, generalized anxiety disorder, between how I manage a patient and how I manage a family member or loved one. So, first of all, I am not specialized in the psychology or the psychiatry field, but being a doctor makes me or obliges me to be able to understand when I am in front of a situation that really needs help and really might need a specialist. There are certain pathologies which I can actually treat or I can help the patient, but whatever is a little more complex goes out of my scope, and that's where we have to understand our own limitations as doctors and be able to refer or transfer these patients for more specialized help. So, I recently saw a patient, someone who I don't know. First time I saw this person through telehealth and managed this patient's generalized anxiety disorder and gave recommendations, at least the initial startup plan for this patient to improve. And I also had the same case in the last week with a family member or loved one. And what I am thinking about once I finished the call with my loved one was that my approach between the two was extremely different. And I am actually happy with my approach and very comfortable with my approach I gave to this patient or this person I didn't know. And I feel very bad about the approach I had with my loved one. Why is this? I guess this, in my case, is because when you are treating a family member, you are imposing your own experiences with this person onto the management. So it's different to see a person you are just meeting than to see someone or treat someone you've known for more than a decade. You think you know what's their way of life. You think you understand how they interact in general. You think you understand their own problems. But the reality is different. The reality is that you never get to know anyone 100%, and you always have to respect this person's view of the world. So, this is a call for more objectivity. The objectivity we give, or we should give the patient we don't know, is the objectivity we should try to give our loved ones and our family. Of course, I recommend every one of you here, which might be a doctor or is preparing to be a doctor, to better transfer your family member to someone who isn't their own blood for further treatment, because there is a lot of subjectivity, and we already know that there is a lot of iatrogenia or mistakes made when we are treating our own family. But sometimes we don't have to have this family member in a hospital, because sometimes our family is asking us for advice. So this is what I'm talking about. I'm talking about a family member that asked me for advice about something, a psychological stressor that seems to be generalized anxiety disorder, and my approach was very different from that of a patient. So what I want to leave to you right here as learning points is, number one, be able to accept your limitations. So be able to give or send your family member or your loved one to the care of someone you trust. Of course, there are all types of professionals, so you have to be sure who you put, who you delegate this great task, because it's your loved one. So that's number one. So remember that not all specialists, not all doctors will give you not having a title, or having a title doesn't give anyone the insurance that this professional is worth it. There are many people out there with titles of general practitioners or specialized titles that actually won't be the best choice for you. So first of all, know who to trust. That's number one. Well, number one is know your own limitations. Number two is know who to transfer your loved one or your patient if it's a complexity that goes out of your scope or your reach. Number three is that when giving advice, try to see your family member as if they were a patient, someone you don't know. So then instead of listening to them, listening to their complaint and just trying to cut them off and trying to dictate what they have to do the same thing you do with your patients, or you should do with your patients. Listen to them from start to finish. Ask them what they're feeling, why they are feeling like this, since when they're feeling like this, what do they think is aggravating their symptoms, what improves their symptoms, etc., etc. But what we usually do with family members is that we know them for more than a decade, and we just have answers for them, and they haven't even told us their symptoms. That's why we make mistakes with family members. So be more objective. Use the professionalism you use with your patients, with your family members. Be able to detach a little from the feelings that usually affect you. So instead of looking at your family member as, your head hurts, so I'll send you a CT scan, and the CT scan is normal, I'll send you now a magnetic resonance, blah, blah, blah. That's not something you would do if you followed the guidelines, and that's not something you would do with your patient. So remember to try to follow the guidelines, to be more objective with your family member as you are with your patients. That's in general the gist of this, but I also want to talk a little about psychological disorders and issues. So we have to understand that my view of the world is totally different from your view of the world. Even if we were raised together or lived together, we will view the world differently. And as the book, The Four Agreements states, we live the dream of the world. Each one of us has a dream of the world, and each one of us sees everything in their own eyes, in their own perspective. So even pleasure, even negative symptom, sensation, we will perceive differently. So it's not the same thing for you to feel sad as it is for me. Some things that may make you sad and may make your day just feel like crap might not be the same for me. So you have to try to empathize with your patient or family member. So if they're telling you, I am stressed out because the sunflower isn't upright and just is slanted down, I think that means that I have done something bad during the week, and that makes me feel terrible. You can't just laugh at that. You can't just ignore what they're saying. You have to try to put yourself in their own shoes. You have to be ready to detach from your own feelings and understand from where they're coming from. That's the most important point when you're seeing a patient in general, or in order to have good communication, such as Jordan Peterson, our greatest psychologist of the 21st century, in my opinion. That is how he approaches it. So that's a clear communication. It's listening to the other person and trying to see how can I add to this person's experience of life, and not how can I dictate or how can I react and try to impose my own views onto this person. So remember that anxiety is something real, that depression is something real. Even though you have never lived through any of these two, understand that having anxiety might be even more burdensome to a person than having a myocardial infarction. So remember that health isn't only the somatic part, or soma is the organs. Health is also your psychological health. So try to help your loved ones have that peace of mind by understanding where they're coming from, and try to pull the rope slowly but steadily, understanding that they might slip, understanding that they might fall, understanding that they might be willing to give up. You still have to keep on pulling that rope till you get them out of the hole or out of the well. But what happens usually is you just want to tell them what to do, and you tell them, okay, you just have to stay onto the rope, and I'll pull it for approximately 15-20 seconds. I'll take you out of there and you'll be fine. What happens is that the other person just doesn't cooperate, and they just let go of the rope when they're just getting out of the well, and that's where you get angry and you get reactive and you start yelling at them and you don't want to pull the rope anymore. That's the problem. So remember, you have to be very patient, and you have to be with them again and tell them, I will keep on pulling the rope even though you fall down. I will give you the resources, and this is up to you. And yeah, but there's only so many times you will be able to remain that calm, right? After many times, well, you might eventually give up. That's of course an option for you, but be reasonable. Be reasonable, and try to keep on pulling for loved ones and also for your patients. So that's what I have for you today with the psychological issues in general, and the difference between seeing a patient and seeing your own family. And yeah, that's it. Hope you liked it. Let me know what you think about it. Any feedback. See you later.